War didn't just transform weapons, it forced medicine to evolve faster than ever before, and honestly, many of the survival techniques developed under battlefield pressure still shape how lives are saved today. During World War II, medics worked in mud, snow, shattered cities, and makeshift field stations where every second mattered, and well, supplies were never guaranteed. Survival often depended on simple, practical solutions rather than advanced equipment. What's remarkable is how many of those methods quietly became the foundation of modern emergency care. Techniques like rapid bleeding control, organized casualty triage, and portable treatment kits weren't created in clean hospital rooms. They were refined under chaos, where failure meant losing someone who might otherwise have lived. Understanding these forgotten medical strategies isn't about nostalgia. It reveals how disciplined thinking and practical innovation turned limited resources into life-saving systems that remain relevant for anyone interested in history, survival knowledge, or real-world preparedness. Battlefield triage changed survival by teaching medics to prioritize actions instead of reacting emotionally. Before World War II, medical response often followed a first-come, first-served mindset. The war forced doctors and medics to rethink this approach because massive numbers of wounded soldiers arrived at once. Triage systems classified injuries by urgency, ensuring that limited time and supplies saved the most lives possible. This structured thinking still guides modern emergency rooms today. A practical lesson from this is learning to assess situations calmly. For example, during outdoor accidents or emergencies, focusing first on airway, breathing, and major bleeding mirrors the logic developed in wartime triage. It's not about advanced training, it's about understanding that clear priorities can prevent panic from wasting critical moments. Portable medical kits became revolutionary because they brought treatment directly to the injured instead of waiting for evacuation. World War II medics carried compact kits filled with bandages, antiseptics, and morphine syrets that allowed immediate care on the front lines. The idea that first aid should happen where injuries occur changed survival rates dramatically. Today's individual first aid kits used by hikers and emergency responders trace their philosophy back to this period. Applying this knowledge now can be as simple as building a small personal kit with essentials like sterile gauze, compression bandages, and gloves. The lesson isn't about copying military gear, it's about readiness. Wartime medics proved that the distance between injury and treatment often decides the outcome. Antibiotics and infection control reshaped survival by turning small wounds from death sentences into treatable problems. Penicillin became widely used during World War II, and its impact on survival was immediate. Before antibiotics, infections claimed countless lives even after successful surgery. Field hospitals emphasized cleaning wounds quickly, using sterile dressings, and isolating contaminated equipment. Modern first aid still echoes these practices. Anyone spending time outdoors or working with tools can apply this mindset by cleaning cuts promptly, covering them properly, and monitoring for signs of infection. The historical lesson is that prevention often matters more than dramatic intervention. Wartime doctors learned that stopping infection early saved far more lives than heroic last-minute procedures. Blood transfusion systems advanced rapidly because, well, survival depended on replacing what was lost as fast as possible. One of the most significant medical developments of the war was the organization of blood banks and mobile transfusion units. Instead of waiting for patients to reach distant hospitals, blood supplies were transported closer to the front lines. This innovation really laid the groundwork for modern emergency medicine and trauma care. Now, while most people won't perform transfusions, the principle still applies. Severe blood loss requires immediate attention. Understanding how to apply firm pressure to a wound or use a compression bandage, it actually reflects the same logic that drove wartime medical breakthroughs. The goal is always to buy time until advanced care becomes available. Improvised splinting and stabilization methods showed how simple materials could prevent further injury. WWII medics rarely had perfect equipment. Rifles, wooden boards, or even folded clothing were used to stabilize broken limbs during evacuation. The effectiveness of these improvised splints came from understanding alignment and minimizing movement. Today, this lesson remains valuable for anyone involved in outdoor activities or preparedness training. A rolled blanket, sturdy stick, or backpack frame can help stabilize an injured arm or leg until professional help arrives. Wartime survival wasn't about perfection. It was about preventing small injuries from becoming fatal complications. Psychological care became recognized as essential because morale directly influenced physical recovery. Combat stress and trauma forced military doctors to acknowledge that mental health affected survival just as much as physical wounds. Simple actions like keeping injured soldiers warm, hydrated, and reassured improved outcomes significantly. Modern emergency responders still emphasize calm communication during treatment for the same reason. Applying this knowledge today means remembering that reassurance and clear instructions can reduce panic in emergencies, making it easier to manage injuries effectively. Why these wartime medical innovations remain relevant despite modern technology. After WWII, advanced hospitals and sophisticated equipment transformed healthcare, but the core principles developed during the war never disappeared. Rapid assessment, immediate treatment, infection prevention, and efficient organization remain the backbone of emergency medicine. For history enthusiasts and survival-minded viewers, studying these techniques reveals how innovation often grows from necessity rather than luxury. The enduring value lies in understanding fundamentals rather than relying entirely on technology. Closing thoughts on how forgotten WWII medical tricks still guide survival today. The medical breakthroughs of WWII weren't created to be legendary. They were designed to keep people alive when resources were scarce and conditions were unforgiving. Many of the practices now considered standard began as desperate solutions shaped by experience and discipline. Learning about them offers more than historical insight. It builds respect for the systems that transformed chaos into structured care and reminds us that preparation, observation, and calm thinking remain the most powerful tools anyone can carry. If you value serious WWII history and practical survival knowledge, subscribe to 0 Hour Survival, share this video with fellow enthusiasts, and stay tuned for more deep dives into the forgotten skills that change the world.